Hello, I'm Dr. Brewer. Shoulder pain can make even driving or rolling over in bed a challenge. This video will show you some simple stretching exercises to increase your range of motion and mobility. We'll also demonstrate how proper posture can ease your discomfort. Please be sure to consult with your healthcare provider before starting any new exercise program.
Hello, I'm Craig. I'm a physical therapist with Allegiance Health, and today we're going to talk a little bit about the shoulder. A lot of times we wake up in the morning or throughout the day and we have a little bit of shoulder pain. A lot of that has to do with lack of motion, lack of strength. Most often it comes back to how we hold ourselves posturally. So the posture is very important when we're talking about the shoulder joints, the rotator cuff muscles, and all of that. So we're going to talk a little bit about the basics of that. And the shoulder, everything that we do is in front of us. So a lot of times most people stand or sit with their shoulders in a forward rounded position, which is bad over long term. You start engaging or pinching off here in the front of this joint and you end up with a lot of pain. So to alleviate that and to decrease that risk of you moving into that, let's talk about squeezing your shoulder blades down and back. There's a couple ways of doing it. I don't want you to use the big muscles in the shoulders by pushing back this way. I want you to use the little lower trap that's attached to the shoulder blade in the back, and we call those scap squeezes. So I'm going to turn sideways so you can see a little bit better. Instead of standing like this, I want you to just engage that lower trap and squeeze your shoulder blades down. And relax it and squeeze down. Don't push them back with the big muscles. Just engage that little one and set it down. Before you move your hands to do anything during the day, the first thing you do is to set that shoulder blade down and back and then reach off of it. Your shoulder blade is the stable base off from which your arm actually hangs from. So let's keep that shoulder stable down where it belongs and then work off of it. You're going to open up this joint in the front so you don't impinge here and end up with rotator cuff problems down the line. Okay? So just do your scap squeezes, down and back. Do that 3 or 4 times. And hold it on the last one and keep it there. Okay? Along the line of talking about the posture, we need to, a lot of times the pec minor, pectoralis minor, pec major attaches to your arm here, pec minor attaches to the shoulder blade right here. And it also attaches to your ribs. So when we sit and stand with round shoulder posture, pec minor shortens up on us and helps facilitate this, which is bad. So let's do a pec minor stretch. And to do that, there's a couple different ways. You can stand next to a wall. I don't have one right here, so we're going to imagine there's a wall right here. And I want you to turn your hand out like this and put the arm up on the wall as far as you can get it. Get as close to the wall as you can. You're going to feel a little stretch, and you're going to go back, turn your hand, crawl your hand backwards until you get a stretch right through here. That's your pec minor. Another way of doing this same stretch is to stand next to a wall and put your arm on the wall so that the wall is just resisting that arm from going forward. I don't want you leaning into it. I want you just standing there. And then, once your arm is on the wall, you're going to turn your little feet away from it until you open this up. You're going to turn and turn until you feel a little bit of a stretch right here, just a little bit of a stretch. And you're going to hold that 15, 20 seconds. And then you're going to turn back. What I don't want you doing is leaning into it this way, because now you're supporting your body weight on that shoulder, and that's a no-no. So just resist, put your arm on the wall, and then turn your feet away from it until you feel that stretch. Okay? Another way, once you've got that stretched out, let's talk about some strengthening of that rotator cuff. There's 4 rotator cuff muscles. We're going to talk about the internal and the external rotators, the infraspinatus and the subscapularis. So the infraspinatus is an external rotator. It turns your arm out like this. And the subscapularis is an internal rotator, and it pulls it in towards your body. Today we're going to use TheraBand. I've got blue. There's a number of different bands out there. You can do resistive band. This is a medium density band. Tied a little knot in it. You put that in the door, and then you close the door so that the band doesn't come out. But you want this band at bent elbow height. So when you're standing like this, the TheraBand should be in the door at this height. Now to strengthen the external rotator, This hand is the door. This hand I'm going to strengthen with this arm. Remember your shoulder posture. Your shoulder blades are down and back, so do your scap squeezes. Make sure your shoulder joint is open. Keep your elbow tight against your side, palm up, and then you're going to externally rotate, pull that band away from you as far as you can. You can do that. Start out with 10 times. You can build up the number of repetitions as you see fit from there. What you should be feeling at the end of this is a little bit of tiredness or burning sensation right back here. That way you know you're doing the right thing. Now to do the internal rotation, you're going to change direction and you're going to pull the band towards you. So the attachment is over here, then I'll be pulling in this way. Okay? So that's strengthening the internal and the external rotators of the muscle, which helps facilitate this stabilization of your shoulder, helps reduce the pain, improve your range of motion.